Hello, my name is Heather Husbands, and I am doing my presentation on ulcerative colitis. Ulcerative colitis is a chronic inflammatory bowel disease that causes inflammation in the digestive tract. It is most commonly found in the lower GI tract, which means it's found in the rectum and the sigmoid colon, which is down here. The cause is actually unknown. However, many have concluded that it might be due to infections, genetic issues, or immunological factors. People who usually get it are people between the ages of 20 to 40 years old, so they're actually pretty young. But children don't usually get it, and older people don't usually get it. Risk factors. Jewish descent are actually people who usually get ulcerative colitis. Age, of course, which is 20 to 40, like I explained earlier. And both men and women actually get ulcerative colitis pretty equally. If your grandmother or mother actually have ulcerative colitis, you have a greater chance of getting it as well, because it is in a genetic way. Signs and symptoms. Ulcerative colitis is actually found. Usually you're going to have pain on the left abdominal side of your body, and this is due to your sigmoid colon, which is right here on the left side of your body. You are also going to have diarrhea, tenesmus, which is the urge to defecate, abdominal pain, melena, and you're going to have remission and exacerbation of symptoms. So you're going to get better, but then you're going to get worse, and you're going to get better and worse, and it's going to go back and forth. Also, if you have ulcerative colitis and you don't get it treated right away, which you should, and you have it for more than 10 years, you have a great chance of actually getting colon cancer, which is even worse. And lastly, the biggest sign is pseudopolyps, which are due to the continual healing and scarring of the ulcers, and inside your colon, it looks like you have shag carpeting all over the place. Statistics: it is more common than Crohn's disease. It appears more in adults than children, which is the 20 to 40 years that I was talking about, and it is more common in the Northeast and Midwest regions. If you are wanting to diagnose ulcerative colitis, the biggest way is to do a complete blood count, an X-ray to see if you can see any inflammation, and a colonoscopy is the most common. The goal of all of these diagnoses and testings is to rule out infectious disorders and to fully conclude that it actually is ulcerative colitis. And then treatments. In order to treat ulcerative colitis, a common way is medications. If you do smoke, you have to stop smoking because that just makes everything worse, especially in your digestive tract. And then surgery, which is the IPAA surgery, and that is the ileopouch anal and anastomosis surgery, and it is a surgical procedure that is used to restore gastrointestinal continuity after surgical removal of the colon and rectum, and that is because it is so damaged and inflamed that it just needs to be removed. And then, of course, supportive care is always helpful because the ulcerative colitis is really painful and the patient is going to be going through a lot. And this is what a healthy colon looks like. This is moderate colonitis, and this is severe colitis. And then here are my references. Thank you.